And my dear students, I once again welcome you all to our TRISA DNB online academic activity. Today we have theory questions, newer advances like questions, and some important clinical questions. And without wasting much of your time, I hand over the session to Professor and the students. First, I request Dr. Satyapriyan to present the topic on Ciprofol.
Good evening, sir.
Dr. Satyapriyan.
Good evening. What is your topic?
Topic is about Ciprofol, sir.
Ciprofol. Okay.
Ciprofol is a GABA receptor agonist. It's a 2,6-disubstituted phenol derivative like propofol. It's a recently introduced IV anesthetic agent, has undergone only phase 1, phase 2 trials. Its
Very good.
anesthetic efficacy, onset, recovery, and clearance rate has been compared with propofol. Ciprofol dose range from 0.4 to 0.6 mg per kg. Studies shown that lesser pain on injection site, favorable anesthetic properties with little residual effects. In a study, we received a dose of 0.4 mg per kg. In phase 2A trial, 0.2 to 0.5 mg per kg of Ciprofol dose compared with 2 mg per kg of propofol for colonoscopy found both drugs suitable and tolerable. In phase 2B trial, randomized trial, 3 groups were conducted. 2 doses of Ciprofol were used, 0.4 mg per kg and 0.5 mg per kg, compared with propofol 2 mg per kg for colonoscopic procedure. Result obtained was equivalent sedation and anesthesia. To conclude, Ciprofol appears to be an anesthetic agent with sedative properties similar to propofol with lesser pain on injection and better cardiovascular system stability. However, further comparative studies are required to establish its superiority to propofol.
Yeah, it's a drug is still not fully approved for use, but because sometimes they ask about the recent advances, sometimes suddenly they may ask this drug, and so I thought I will just ask or include it in the discussion. One more point you can add to this is this is a propofol analog. It is very much similar to the propofol, except that it has got some extra chiral center and can I share my slide? Is it try to share?
Yes, sir.
So this is, are you able to see the slide?
Yes, sir.
So it is because still it is under evaluation. It has got a chemical number. Usually drugs which are produced, we are not given the name straight away. So it has got a number called HSK348. This is the number allotted to that drug, which is in still evaluation. So this is a propofol analog with improved pharmacokinetic properties. So it has got, it is a propofol, all of you know, it's a 1,6-di-isopropyl phenol. So similar to that, this is also a phenolic compound, but the structure is slightly altered by the addition of a or this is the chiral center and a cyclopropyl group. This blue triangle is a cyclopropyl group, which improves the pharmacokinetic and physiological properties, mostly making it more potent than propofol as well as eliciting less pain on injection. And its dose is much lower compared to the dose of propofol. And because of that, probably the pain on injection is very much reduced, and the onset time is also very similar to propofol, and it is 4 to 5 times more potent. That is seen by the lesser dosage that is being used for that. And they have tried this mainly for endoscopic procedures, namely colonoscopy and gastroscopies have been done with that, and they have found that the repeat doses for sedation is very much reduced compared to propofol. In one study where they have done a colonoscopy, they have to give 4 to 5 doses of boluses of propofol to keep the patient quiet, whereas only 2 doses were required for ciprofol because of its higher potency. And so, because of higher potency compared to propofol, there is a slightly delayed recovery time. Propofol patients wake up much more faster, whereas ciprofol, it takes a little longer time. And this drug is mainly being tested and trying to be marketed from China. So the Chinese pharmaceutical industry is trying to promote this drug, but it has been so all the papers and studies are mainly from the Chinese medical anesthesia fraternity. So, but still it has not been completely approved. But in the future, it may come into practice because of the more potent and less pain on injection, and even the hypotension and bradycardia, which is common with propofol, is supposed to be comparatively less with ciprofol. So the two advantages they claim are, one is less pain on injection and less hemodynamic suppression. Like propofol, it doesn't cause that much of hypotension and bradycardia. So cardiovascular stability is also supposed to be much better than propofol. So this much is only you can write about for this, and so I think that's more than enough for this particular drug. Okay, you can go to the next question. Who is presenting the next one?